Hello and welcome to Dr. Obi's Parent Management Training. I am Dr. Obayuza Adele, a board certified child, adolescent, as well as adult psychiatrist. I am also a board certified pediatrician with over 20 years experience. And in these videos I'm targeting that audience of parents who have children who we use the term act out. Video 1, which is obviously this video we're starting today, is helping you understand your child's behavior. So majority of children are at times defiant. Every child at times gets angry or irritable. However, when this becomes a pervasive pattern of behavior, which means more than half the time your child is angry or irritable, easily loses their temper or becomes resentful, is argumentative, or you could use the term talks back, and some parents would use the term disrespectful. If these children are 2 years old to 4 years old, it's not unexpected. You know, at the age of 2 we talk about the terrible twos, which means children have what we call low frustration tolerance. They're easily frustrated, easily irritated, they don't know what to do with their anger, and they have a temper tantrum. But when that anger and temper tantrum persists beyond this age group, so children 5 years and older, let's think about children from the stage of kindergarten, and definitely children in first grade and over first grade are considered old enough to learn to deal with that anger in a way that is not disruptive. So these are the children I particularly am referring to when I say children who act out. So if you're a parent, if your child only gets angry or has a tantrum, maybe, you know, once every month or once every few months, and if they're not disruptive to an extent that exceeds the degree of concern, then they might not fall into this category. So sit back, relax. These videos might still be helpful for you, but you can understand that this is normal childhood behavior. So for children who frequently misbehave, let us try to understand this behavior. And behavioral specialists will tell you that every behavior has a reason, and if the behavior continues to occur, which is when we call a pervasive pattern of behavior, in some way or in some regard, that behavior is being positively reinforced, which means there might be an antecedent. I will use that as an A to the B, which would be the behavior, and then C would be the consequence. And if the consequence is a reinforcer, it means every time we enforce that consequence, we increase that behavior. And everyone might think, how in heaven's name am I reinforcing my child's negative behavior? Yes, you're right. We can reinforce positive behavior. We can reinforce negative behavior. So let us try to understand this pattern of behavior. So the antecedent, or what sets the child off, the most common things parents tell me is when I say no. So child makes a request, I say no. B is the behavior. They get angry, they get frustrated. It might be verbal aggression, where they yell, scream, cry, or have a tantrum. It might become physical, which will be more extreme. So we definitely want to measure the intensity of these behaviors. Is this just a child who cries or whines? Is this a child who yells? And is this a child who maybe becomes physical, throws things, maybe hits others, or gets physical aggression such as punching the wall or something to that regard? So those would be a high intensity behaviors when we're getting to physical aggression, but verbal aggression is also of concern. That is the B, the behavior. The C is what is the consequence. So most of us as parents will definitely identify with this. My child misbehaves, the first thing I do is yell, Or for some parents, there might be a consequence which we are trying to discourage using physical reprimand. So any parent who is, the term we use here in the South is whooping the child. The reason why we counsel against physical reprimand is because we are trying to model behavior for our child. And when you say you model behavior, it means when I as a parent get angry, what do I do? Do I hit you or whoop you, as they would say? And if that's the case, then the child is pretty much being given permission. If someone makes you angry, hit them, whoop them, or fight them. So this video is not for you if you feel that physical reprimand is the way to correct your child's behavior. We have already outlined here that is strongly advised against. The reason being, physical reprimand can become very aggressive for your child. It can hurt your child. It could be a form of domestic abuse. It could be a form of physical abuse or domestic violence. So let us try to model positive behaviors. And if anyone is using physical reprimands, I hope today will be the last day you would consider that suitable for correcting your child's behavior. So we yell as parents, and many times it becomes an argument, a back and forth. So child continues to talk back. We as well talk back, and that's how an argument ensues. And the consequence for the behavior, step one will be parent gets angry, parent argues, parent yells, and then we might finally maybe take away some privileges. So some parents take away electronics, some parents use timeout. We will learn how to use timeout effectively. So you might say, oh, that's the consequence. So how in heaven's name am I reinforcing my child's behavior? Well, this interaction takes quite a while. So what you've actually achieved, or your child has achieved, is delaying following through. And in many cases, we even forget the reason why the argument started. We end up focusing on the consequence. The child has possibly avoided that chore they didn't want to do, or whatever direction or instruction the parent had. So the child actually wins here. Yes, they might have felt a little pain. There might have been a little distress or anxiety from the argument that ensued. But for the child, that is a preferred alternative to following through with whatever behavior parent had, or whatever request parent had for them in the first place. So as you can see, this pattern of behavior is actually reinforced. So next time mom says, do the dishes, I might pretend not to hear her, as many children who are oppositional do, and then she might get angry and yell. So the B is the behavior. I might get angry and yell back, that being the child, and then sees the consequence. We've delayed you doing the dishes. You might end up on timeout. You might end up not doing the dishes at all, or you might end up losing a privilege, which for a child might be a preferred alternative to doing the dishes. So take note of this, parents. We want to break the cycle. So breaking the cycle means stopping at the B or the A or the C. We want to stop that positive reinforcement that keeps the cycle going. So keep that in mind, understanding your child's behavior. There is actually a reason for the behavior. We're actually reinforcing the behavior if you persist with the pattern at play. And that is why the behavior continues. It doesn't stop. So we've tried to understand our child behavior. We've tried to understand the reason for the child's behavior. There are other reasons behind this behavior pattern as well. As we all know, parents attach to their children, and the way attachment occurs from the time of birth, when the child is very dependent, is we cater to their needs. We feed the child, change their diaper, we soothe the child, rock you, burp you, and put you to sleep. And for most children, this is sufficient for them to attach, and these children understand, if I have a need, it will be met. Such children tend to self-soothe better. They know to wait, mom will come, I don't have to yell for 1 hour, she will come pick me up, and once it's time, I don't need to cry for too long, she will change my diaper. So these children they're somewhat more a calm temperament. So don't blame yourself for this, our children's behaviors when they're defiant or oppositional. non-compliant. Many of these children have a temperament that is more irritable. They might have been the colicky baby. Doesn't matter how many diapers you change, doesn't matter how many times you burp them, they're gonna fuss. And then as parents, every time they fuss, we pick them up. So we're actually reinforcing that fussing behavior, and they never learn to self-soothe or settle down. So part of our parent management training will involve helping your child learning how to self-soothe, how to calm down, how to be mindful, and start to reduce that level of frustration when they can't have their way. So understand that temperament matters. Genetics might have a play to the temperament of a child. And we're not saying there's no attachment. There's an attachment here. It might just somewhat be disordered, where the child needs the parent to respond. They never learn to calm themselves down or self-soothe, and they really have no way to regulate those emotions. So I'm still colicky and I'm 16 years old. That's a big problem. So parent management training is helpful not just for the child, not just for the parent, for the child as well. So you could also call it child management training. And the last thing I will add to this equation is the temperament of the parent. So a parent who is very anxious, you can imagine her having a child who, I just fed her, I just changed her diaper, I settle her down nicely, and she starts to cry. Oh, I feel like I did something wrong. I pick her up again, and the cycle continues. So parents who are anxious themselves might actually be unbeknownst to them, be reinforcing this child's irritability, this child's fussiness, this child's low frustration tolerance, by not letting the child learn to self-soothe. Because anxious parents, you could say, maybe have anxious children as well. So if you're an anxious parent, these videos might be helpful for you to learn how to be mindful of that, and help you learn how to also learn to regulate your emotions and model positive behavior for your child to copy. So video 1, understanding your child's behavior. We've come to understand that every behavior has a function, as well as the child's temperament might have a thing to do with the child's behavior, the genetics behind the child's temperament, the parent's temperament also has a thing to do with the child's behavior. And I'm sure you might have other ideas, and you can comment on the video as to other things you feel might contribute to your child's behavior. So we're talking about children here without behavioral health or psychiatric diagnosis. So these are not children who've been abused or neglected. These are not children with depression, anxiety, bipolar disorder, or any other kind of psychiatric disorder. We're talking about regular kids who might be somewhat acting out. So keep it in mind that if a child has a behavioral health diagnosis outside of just acting out, then that's another factor that might contribute to their low frustration tolerance, as well as their irritability. So children with anxiety, depression, ADHD, many of these kids are irritable, and yes, they might need certain kinds of treatment outside of parent management, but parent management training is helpful for all children, regular kids with regular behavior, children who act out or misbehave, children with any kind of psychiatric diagnosis. We just don't want you to rely on just parent management training. We need kids with other diagnoses to get the help they need. So thank you for listening to our first video on understanding your child's behavior. Have a good day, and don't forget to press like or subscribe, and I will see you at video 2. Bye bye.